있습니다. I already induced the IV sedation with the propofol.
Normally you have an anesthetist in-house or you do it?
We are in Korea. Usually the surgeon can induce this kind of IV sedation. It's not anesthesia. It's IV
No,
sedation.
but then we need an anesthetist
I
in
know.
India.
So for the general anesthesia, I usually I call the anesthesiologist.
Yeah.
Okay, I'll start. I'll apply the thread the on lateral face, medial face. If the situation permits, I insert some more cabin here as well. So first, I can also apply some more dental lidocaine, which can contain epinephrine. 또 주세요. 불 좀 맞춰줘. 불 좀 맞춰주세요. 이거 몇 개째네? 세 개째야? 세 개째지. 하나 더 줘. 세 개 넣었지? I'm infiltrating the dental lidocaine solution. Oh, really? I see. So are you from London?
Yeah.
Oh, what a nice city. 어디까지 했냐? 내가 이렇게 하면 되는 거야 이렇게? 포폴 8 주세요.
약 주세요.
한 명 킵해줘. 포폴 8 해주세요. 버리고 새로 주세요. 이거는. 야, 아직 안 들어갔지? 들어갔나?
네.
The IV sedation is not always required.
Yeah.
But today, there is a lot of doctors. So to make the patient comfortable, that's why I induced IV sedation.
Can I ask you something?
What's it?
Patients with like a lot of nasolabial folds and all those things and wrinkling and a lot of excess skin in the neck, don't you think facelift is a better option than doing threads?
Definitely, but the indication of the strap lifting is far different from that of surgical facelifting. They need something simple and easy. They don't want to have long duration time. That's why they select the strap lifting. So the indication is different.
The
So
surgical-
yeah, definitely the surgical one is far better.
Far better, yeah,
yes,
it is.
but they want something very soft, something very easy, and they want to be recovered fast. Uh-huh. I'm plastic surgeon, so I'm also doing the facelift, conventional facelift as well. But even though I invest a lot of time,
doing threads.
doing the conventional surgery, but the cost is almost the same with the thread lifting nowadays.
Yes, because
So-
the material is expensive, right?
Yes, but in my case, because I'm a key doctor of this
Okay, so but then
company.
if anybody else wants to do, if I'm using so much of threads,
That's
I would
why.
rather do a facelift and finish
Definitely,
it off.
facelift is more effective.
More
but
effective,
the-
long lasting.
Yes, but nowadays the
Trend is
concept
changing.
changed. Yeah, trend is changed. They need something very simple, not so painful. The recovery time should be very short.
Yes.
That's why we try to run this.
But then the results are also like 1 or 2
Definitely, the
years
conventional ones are far better.
far better. It's
Uh-huh,
like at least
definitely.
8 to 10 years we can. Here at least like what, 1 year, 2 years?
It's really it depends on the skin status of the patient. From 6 months to 1 or 2 years, but it depends. But the purpose of this procedure is to make the patient come again, like
Okay.
filler or toxin.
You have to come back again
Yes,
and again.
yes. And many doctors here are not the surgeon, so they want to do some procedure which is very simple. So thread lifting targets it. The purpose is a little bit different. Okay, I applied the long type dual. 이제 한쪽만 먼저 해야 된다. 내가 까먹고 양쪽 하려 그러면 말려라. So, excuse me for a moment. I'd like to check the patient's status first. So the jaw is dropped. There's a prominent, but the labial fold, drooping, jowl. The anterior molar is flat. Okay. So
You know what, the skin type of Korean people is very good.
I don't think that it's good. It's really difficult to lift. So, the skin is heavy,
Very heavy.
thick,
Very thick.
so it cannot be easily lifted by the thread. So I should insert a lot of thread, a lot of thick thread. But Indian,
It's easy.
far better, easier.
It's easier.
The Middle East Asian, far easier. European,
But wrinkles, it's more in Indian. Indians.
right. So if you have more wrinkle, you can get more job.
Yeah, exactly. Exactly.
So, if I lift the face, I should pull the tissue upward. So, but it may cause some irregularity. That's why I put the patient on head down position. So, I applied long time dually this thread. First of all, it's a U-shape application. 두 개를 동시에 주다니. 잡아라. So, because there's bleeding, then I can 좀 잡고 있어라.
That's your anchoring point.
Yes, anchoring point. Or go down and come back. 한쪽에만 한다 그랬다. 전체다. 300도 써야지.
I want to ask you something. When you're using the cavern,
Cavern.
yeah, so it causes a lot of fibrosis, right? So second time when you're doing cavern again, let's say probably 6 months or 1 year, there is volume loss again. So when there is fibrosis, when you're doing it again, won't it be difficult when you're going in, or probably third time? There's so much fibrosis.
Yes, I expected, but it wasn't easy. It wasn't easy for me.
Yeah.
So I can try it easily. I mean, it wasn't so difficult.
Third time, fourth time?
Yes. But it can accumulate a lot of fibrous tissue.
Issues, yeah.
But it's okay.
You can go in.
Yeah, why not?
So every time, like every year, if you can
It's
go.
far different from surgery. The surgical one has a lot of foam
Lot of
parts, but it's different. It's not so foam like that.
No, it's not that kind of fibrosis.
잡아보세요. 저쪽부터 먼저 잡으세요. 잡히려고 일부러 이러는 거지 지금 우리. Okay. So we should insert the thread exactly the same hole that I made. I should insert advance the thread along subcutaneous layer, or it can stimulate superficial temporal fascia. It's very sensitive, so it can make some pain. 퍼플 팔 주세요. Even though I can make some dimpling here, it's okay because it's under hair. It will not be seen. 퍼플 팔 주세요 일단.
많이 움직였어요.
아니요, 많이 안 움직였습니다. So, and you know, if I pull the skin here, this area will be protruded. It will protrude.
Yeah, because
So
it's buckling, because
yes,
it's excess.
yes. So, but it's okay. If I do that here, it can be seen. So, from the temporal area and to the side bun, actually the distance is about 8.5 centimeter. That's the secret. I tried many times, but 8.5 is optimal. So you should make you should make the letter W. If I come out the same hole, it can be easily released.
So maybe something very close to that.
Right. 발음 공부를 1년씩 넘게 해도 하나도 안 들어서 그냥 급하니까 옛날 발음 나오는구나. 오케이. 자, 줘봐. So usually I applied this side, this side, this side, this side. But today I applied, yes, on the right side, and then I applied the left side. So I also apply another thread on mastoid. Are you a surgeon?
Yeah, maxillofacial head and neck surgery.
I see. I'm also doing the conventional surgery, but nowadays the patient who want to get this kind of thread procedures are far more than that of conventional one. So that's why we should follow the needs.
교수님 시술 부위 한 번만 더 설명 좀 부탁드리겠습니다.
예, 그 마이크로 말씀하셔도 안 들리나요 여기서?
한 번만 더
Okay.
말씀해 주세요.
I applied long type dual lifting thread on temporal area to lift the lateral side of the face. Now I will also apply another dual lifting long type on post auricular area to the jawline to lift this side to make the jawline.
This one marionettes?
Yes. So, and the general jawline. So it's different from the short time dual lifting. It has co-even end portion of the thread, so it can create dimpling here. You can observe it. So, okay, I will not remove them. So there's a dimpling. Okay, 주세요. Short. I will apply short dual lifting here. Anterior point of the tragus. So it's a U-shape application, but now I apply this V-shape one. 저기 니다부터 줘봐. The hole should be big enough because I should insert two needle on the same hole. It's short type dual lifting thread. 갤러리가 있으니까 좀 더 낫네. Okay, 줘봐, hook. So if there's dimpling, I should reserve it immediately. So let's compare. This is short type dual lifting, no dimpling on the surface, but a long time has dimpling. That's the difference. So make some dimpling here. I should reserve it again. Then I will apply Kogmaster gear on the medial part of the face because the dual lifting is thick thread. It's as thick as 1/0 size. But I prefer a Kogmaster gear. It's 2/0 size, slightly thinner. Yes. 니들? Kogmaster gear 내겨줘.
What would be a vector for nasolabial?
Well, so I do not believe we can disappear the nasolabial for the brow lifting, but it can slightly improve it. So till now I just lift laterally and upwardly, but it makes the patient's face flat and wide. Usually, Korean has a flat face, so they don't like to make their face wider. So this upward and medialized factor is also very important. We should augment this area, anterior malar. So I tried many techniques, but it's very optimal. That's why I apply it. So this way and tie them here, and I can also look this way.
Upwards.
이들 어디 있어? 안 했어. So I usually make a hole at the most protruding portion of the towel. So it should be big enough because we should vary the knot of the Kogmaster gear. Then I can insert the thread along the subcutaneous layer. The layer is important because on medial portion the layer is very thin. Each layer is very thin. So when I reach the dermis, I can fix it and then twist to round and remove the cannular. So the thread will fix into the tissue easily. The same, I can insert the thread to the lower eyelid, mid portion of the lower eyelid, and then to round, remove the thread. 포폴, 팔 주세요.
So here point of fixture is the orbicularis muscle?
Actually the point is not so important, but I usually somewhere around there, so muscle, but I try to fix it on periosteum.
On the periosteum?
Yes, periosteum, but the layer is very different. It's okay, even though it can be fixed on a muscle or periosteum. It's okay because the anchoring is not so hard.
It's free floating. I mean, it is not.
Right.
Yeah.
But I will tie them here.
Okay.
Why?
Yeah, this is what. Okay.
It's not free floating now.
2 times.
2 times.
This is on
Actually, I failed.
this is 18 or
Sorry. I should remove this. Okay. 자,
This came
또 줘봐.
out. Did
Okay.
the whole thing came out? Normally it should fix up, right?
오케이. 한 번 더.
This is 18 or 19?
19.
19. Yes.
Smaller size. twice.
Okay.
Okay. Without. Oh, again. It's okay. Then I'll put it easily this way, and then I can apply 2 more thread from the saturation 얼마야? 옷도 좀 더 돌리고 볼게. 미들 좀 펴야 되겠다. So it should be advanced to the 1 centimeter lateral of the natural radial fold. If I approach it to the very fold, so it can deepen the depression here. So here, not here.
1 cm short of the.
Not 1 cm lateral of the natural radial fold. 됐고, 그러면 거의 끝났지? 또 뭐 넣어주면 되냐? 오케이, I'll apply cabin short 줘봐. cabin short가
What's the reason you said why you should be short of 1 centimeter?
yes. Okay. It's like this, not here. If I fix the thread and here,
To the nasolabial.
yes, it will pull this side. So it will lift the nasolabial pull different this way. So it's okay, but it makes
Yes.
the pull
Yes.
deep, more deep,
Yeah.
deeper. Yes. 캐번 일단 4개 나와봐.
So doctor, you can insert from
Lateral molar. Yes, because if I insert that position, it should follow the curvature, but it's a straight thread, so it can make some contour disturbance. That's why.
What we have
Uh-huh.
read is for nasolabials, we're supposed to go from the pre-auricular area and go 1, 2, 3 and lift it back.
Well, actually, the angle of Koreans are very. The angulation is high.
Okay.
So if you approach here, so it's
Oh, you cannot reach
yeah,
there.
and then so you can also aggravate the lateral cheek hollow as well.
so it's advisable insert from
Yes.
So
Yes.
then it
It's a
depends
kind
on
of
the race.
example. It's a kind of example. So if you find out good factor, why not?
Yeah.
You can apply it. 자, 다음에 나 뭐 해야 되냐? 캐번을 어디서 할까? So she has a prominent marginal line and nasolabial fold. I try to reduce it. 여기 정도에. 이 정도 넣을까? 이 정도? 오케이. 캐번 쇼트 줘보세요. 쇼트. It's carbon thread. Dense cord thread is loaded on a cannula, and this is auxiliary tube. I can insert the thread along the subcutaneous layer. The layer is very important.
Subcute only.
Subcutaneous. So we should across the marionette line. This is the marionette line. You should across because the purpose of this procedure is make different plane the same. There's a stepping here. I will reduce the stepping. Because it can be a clump, another clump, another clump. It will become a plane. So one. So 하나 더 줘봐. Two. So it should.
Can't we do the same thing in nasolabial?
Yes, I will show you. But you should know, I mentioned that you should be very careful when you apply the cabin on nasolabial fold. It can compromise the terminal portion of buccal branch of facial nerve. You should be very careful. So you should keep the right layer, subcutaneous layer. If you go deep, yes, it can compromise the nerve. So under here. So across the nasolabial port, it should be inserted superficially, just under the dermis. Okay.
Do a little slowly.
Oh yes. I'm so sorry. Sorry. It's my habit. Slowly.
Okay. Acha, okay, that stays.
You should push the axillary tube into the skin.
Acha, this also should go inside the skin as well.
And direction going to the nostril or you just across the line?
Sorry?
Direction.
Yes.
Yes.
This direction for volume replacement. This direction for reducing the stepping. Okay? But you know, it's too dangerous. It can compromise the nerve easily. So you should be very careful. I just follow the pathway of filler injection. I usually apply this applied filler in this route, so I could find that it's safe.
So for deep nasolabials, I think we would need both volume and
Yes.
reducing the
Yes.
step.
Yes.
We have to do both.
But and I also can add some more filler on it as well.
How do you increase the volume with PDO? Mono PDO? No, if I don't want to use
cavern
itself.
Cavern or
So if I
multi-fill.
don't want to use the filler.
Yes.
So-
Why not? Why not?
So
You
two
can.
cavern in this direction and maybe two in this direction.
Usually I inject 0.4 cc filler here and then insert cavern this way first and then insert cavern across the line second. 자, 다시 합시다. 또 오케이, 한번 앉혀봅시다. It will last dramatic because it's Korean. Can I have further? 뽀뽀 주세요.
예뻐하지 않다야.
네, 예뻐지겠습니다. 오케이.
Same. What's that called? Cavern.
Yes. 오케이. 자. So I applied the left side very quickly. 잡아. 오케이. I should apply it quickly. It's a long type jewelry thread. 또 이들 이제만 you should be very careful when you apply the thread on natural board. 됐어. 잘라주고 자, 주시고 we can resolve the tinkling immediately. Hot. You have to cook here. 또 주세요. Want a bit larger to the natural fork. 오케이, 줘보세요. 리더, 저 작은 거 2개만 줘 일단. 포펄 18 주세요. 주무시나? Yes, I can. Another thread in here. 또 주세요. Okay, I apply 2 more carbon thread here because we have a lot of patients today. This is the end of this procedure. Thank you.
If you want to do the tear trough with
Tear
cabin,
trough, yes.
how do you do it?
저기 좀 갖다 캔라 좀 줘봐. 캔라 아무거나 줘. So I can insert the carbon thread this way, 2, 3, 4, and then there's a prominent thread here, tear trough here. I can insert one more thread from here to this way.
Cabin. So totally fine.
This is the filling. This is the making of plane.
Okay, so just one filling and maybe 3 or 4 to get it to the same level.
So you should insert the thread under the orbicularis oculi muscle because if it can be exposed on the surface easily because the skin is very thin.
Okay.
Okay. 어? 안 쓸 거야. Okay. This is the thing.